the other side of ransomware.
Hey, Stan, so it looks like today you've got a story or perhaps a follow-on story to one of our more favorite ransomwares, Ryuk.
Yes, Manny. I thought this was an interesting story. I read about it on Bleeping Computer. It's about something that we see quite frequently. In fact, we saw it last year, and we cover Ryuk pretty frequently on the show here. What's interesting about this story is that one of the victims, who was a victim of Ryuk, kind of discussed some of the costs associated with handling the ransomware attack. So one thing to note, according to Bleeping Computer, they're able to attribute about 20 different companies becoming victims of Ryuk ransomware per week. So whatever these gangs are or these adversaries that are doing these campaigns are targeting about 20 victims per week last year. And there seemed to be a heavy push to target healthcare providers. So in any case, this specific victim mentioned that they have about $67 million in losses dealing with this attack. And I thought it was interesting how they broke it down, because we don't really usually hear these numbers. So the first thing was a lost operating income. So because their assets were offline and things like that, patients couldn't be seen and maybe weren't processed at the same rate that they normally would be when there is uptime. So there's some lost operating income because of that. And the other thing we don't think about frequently is as well as billing. So, there's all this billing that goes on, right? There's a certain amount of income that's supposed to come in for things that services already rendered. And if you can't do the billing or you can't process the payments, things slow down and your cash reserves might be impacted. So some metrics like that could be impacted. And the other thing that can happen with a ransomware attack that they covered in the $60 million is the operating expenses of recovering from the attack. So there is maybe increased overtime for people to come in and recover the IT assets. It's probably professional fees for forensics or initiatives that have to undertake in order to recover from the ransomware attack, to bring the assets back online. So I thought it was really interesting. I recommend everybody check out this article. It kind of, I think sometimes when we talk about malware, we forget about the costs. And so this article kind of brings the cost factor back into thinking about the adversaries and their attacks and the actual pain that it causes to a business.
Yeah, so I think, Stan, part of the numbers, I don't know if it was in the article itself, but I would say there's probably about 10 million of those dollars that account for fudging of numbers, I'm sure.
Well, I think those are things like, lost potential revenue and things like that probably account for a large percentage of it. But hopefully those are based on some kind of like historical baseline, because you can't really know how much money you lost. But you can know approximately how many patients you would have seen like the same time last year. So hopefully not too much fudging, I guess.
Right.
But I think some of the fudging is probably due to, when you have to get something in an emergency, it always costs a little bit more, but maybe you don't care at the moment. So I think as consumers, we can all relate to like maybe shopping online and finding the best deal. But when it's an emergency and you need something, you're probably not doing that. And you're probably not getting like the best bang for your buck. So those professional fees are probably a little bit more expensive than usual because, well, I guess they can be.
Obviously, all kidding aside, it is always interesting to see, companies, and I don't think every company comes back and at least, makes it public like this in terms of how much their loss is. And perhaps maybe some of the driving factors is that, they probably have insurance that is potentially going to cover some of these losses. But it is interesting to see such high numbers when you start to like add things up. And I'm sure there was, a whole room of people, including lawyers, who were taking the calculator out and starting to add this stuff up and start adding in, salaries for the support people and salaries for the, like you said, the people that had to come in and actually clean this stuff up and work weekends. And but I think the kind of scary part about all of this, and I'm not sure if the article really touched a lot about this, but what was more scary is that you have a hospital that was not functioning for quite some time. So what was happening to the patients that were actually in this hospital needing to get attention and stuff? I'm hoping that kind of went forward, even though they may have had to like write things down on a piece of paper to keep track that, they gave somebody a shot and they need to go charge them for that later. But that, to me, when I was reading through this, I'm like, man, this article is not, and maybe the article really wasn't about talking about those pieces, but that's what when I read through that article, I was thinking to myself, man, if I was in that hospital when this stuff happened, I might have asked for me to get taken out of there, right? Like ship me to another hospital, because I'm not sure if I want to be here when, things could get really messed up from a system perspective. Like, me being a patient in that hospital, what's to say that my record isn't like messed up and they give me some shot for something that I don't have or something like that, right? That's my fear.
Right. I think they did mention that patient records weren't impacted in this situation, at least for this victim, but that is a scary thought to think that you're like in the hospital and maybe you can't leave, or you're in a healthcare facility and now you can't leave and you have to continue getting treatment versus, like maybe one of those urgent care places where you can just choose not to come in. You can just go to the one next door that doesn't have the ransomware attack. And I think a lot of the costs that they reported was these missed opportunities of people just going someplace else, probably. But it is very, very scary. I think this follows the trend we saw last year and continuing to see of cyber attacks really having a significant impact on our daily lives now.
So I think there's a learning experience for this hospital, because they should have had on the front end, all of these things, the security protocols in place, especially with HIPAA, to be up to HIPAA standards and so forth. So yes, this, like Manny was saying, this is very scary when it comes to your records, your medical records and so forth. And then with these, I don't think many organizations learn from others who get hacked and, put in the right, security protocols just so that it wouldn't happen to them. So no one's learning from the next person.